Hello and welcome. Today we are discussing medical laboratory science field in South Africa. This is a broad field and yet unknown to a lot of people. When I tell people that I'm a medical laboratory scientist, they say, what do you do? Where do you work? But I want to assure you that it's a broad field and there's a lot of opportunities if you want to join. So the structure above the main guy is a pathologist. This is a specialized medical doctor. After you've studied to become a medical doctor, then you can specialize in laboratory medicine. These are the people who can confirm a diagnosis. They don't really work in the lab. When we are stuck, when we don't know something, we can forward it up to them. I'm a medical laboratory scientist. So what do? We do the testing, we run the tests, and we find the diagnosis. When there is a query, then that's when we can go to the pathologist. Then below us, we work with technologists. But technologists and scientists is the same people. It's just different qualification. I'll get into that. Then we have medical technicians, lab assistants, phlebotomists, and nurses. They all work together to form part of the lab. The lab is a lot of careers. These are the main careers. So we have nurses and phlebotomists. These are the ones that have direct contact with the patient. They go and draw the bloods of the patient, be it the stool, the sputum, any bodily fluid that comes from the patient. They are the ones that get direct contact with that. Then they bring it to the lab. The lab assistants, they process the specimen. They sort it out to give it lab numbers, to sort it to which department it should go, and it gets to us, the technicians, the technologists, and the scientists. Then we run the tests, and we can phone back to your doctor to give them your diagnosis. So it is okay to say that doctors are the ones that cure you, but behind that doctor, they cannot give a diagnosis without the lab. So focusing on who is our client is mainly your doctor or the insurance companies. Insurance companies, they want to know if a patient is HIV positive or something like that before you sign for insurance or something. We service those people as well. And we have private patients. There are people who are on warfarin, on other drugs. We monitor their drug levels and their well-being every day. So every time I look at a patient, it's also my patient, though you don't know, but you might be one of my patients. So there is no diagnosis without the lab. So we are specialized because there is a broad number of diseases. Not all scientists do the same. I did what we call clinical pathology. Clinical pathology, it deals with the chemistry, the hematology, and the microbiology. It means that I can work with people's stool, people's sputum, people's blood to find a diagnosis. However, there are also people who are specialized in things like histology and cytology, cytogenetics, and molecular. The guys who are doing the COVID testing now, they did virology and molecular. We respect those people. We need those people. And for you to work with people's specimens, you need to be registered with what we call the Health Professions Council of South Africa. It's the board that oversees how the lab works. They monitor us, they come and see our standards. Are they okay? So for you to work in a lab, you need to be registered by the Health Professions Council of South Africa. There are a lot of problems where people study a similar course, like people who do like biosciences at other universities, like the University of Western Cape, other universities. Those things, yes, they are fine, but for you to work in the lab, you need to be adopted into the system of the Health Professions Council of South Africa. So it is wise for you to look into the university. Does it register you with the Health Professions Council of South Africa? Because you might do a similar course, but it's not registered. That's a problem. So universities that are currently registered with HPCSA is the CPUT, the TUT, VUT, and MMU. And if you want to study certificate courses, you can do with NHLS and Pathcare Academy. They offer phlebotomy courses and technician courses. Thank you so much for listening to this video. And if you have questions, you can just comment. Thank you.